We're lucky that most patients probably can continue care with their local oncologist, and that can be a great benefit. For one thing, it's probably an easier commute and maybe better parking than coming to one of the specialty centers, where, especially in the city, there can be hassles, parking, getting there, all of that. But because some of these advantages can be a bit nuanced, for example, in the BTK inhibitors, we now have several of them. So it's a bit of a nuanced decision of, oh wait, is one better than the other? Ibrutinib, acalabrutinib, zanubrutinib, and some others coming down as well. Or to make this decision of BTK inhibitors versus BCL2 inhibitors. We think it is probably worthwhile for every single patient to meet with a CLL specialist at an academic center. But for most of the folks that come visit me that have a local oncologist, most of them I say, great, we've got all information. We are in communication with your local oncologist. You can mostly continue with them, maybe see us once a year, or just they'll keep us apprised of any kind of changes. So I think the best approach is sort of a sharing approach where we have the academic oncologist giving best advice and the local oncologist being involved in day-to-day stuff.
I think in order to find, for a second opinion, I think first and foremost is if the patient is satisfied with the approach the oncologist is taking. I think that's important. Sometimes we have multiple right answers and no wrong answers. That essentially leads to a choice where all of them are equally good choices. And in those cases, this is important to get a perspective of different physicians of what the benefits and what the risks are of each of these approaches. I always recommend my patients to get more opinions as long as they're not overburdened by the number of choices they have. So if they feel that that they have made a choice with their oncologist, but that is not fully in line with the values that they have, or fully not convince them that they are going in the right path, then I think it's not a bad idea to get a second opinion, just to make sure that they are actually getting the standard of care right treatment options. Sometimes, if they have gone on, if there has been a change in the projected pattern of history of disease, if a disease was responding fine to treatment, but at some point has stopped, and if it doesn't delay a treatment, then it's good to have a second opinion. It's good to try to find out if the next line of treatment is right. And sometimes it's important to get a second opinion just to find out about more clinical trials, because all clinical trials may not be available with the primary oncologist or the first oncologist that you go to. You might find more options of clinical trials in the next oncologist you go to. So those are reasons often to get a second opinion. But at the end of the day, you also want to stick to the oncologist you're more comfortable with, and to a person who's easy to approach, not just the fact that you like an oncologist, but physically easy, because you do not want the just traveling to an oncologist and getting therapy to take an undue toll on your day-to-day effects. So that is also something to keep an eye on. I think I do not know how it used to be in pre-Google times, but I think patients are a lot more informed now. They understand, in spite of these often anxiety-provoking, but this large amount of resources and confusions. But patients in general understand what's happening to them. So I do not think it's always the case that just being told to undergo this watchful wait or surveillance triggers them to take a second opinion. Sometimes even a more aggressive form of cancer treatment can also lead them to go for a second opinion. So I think I do not believe that's always the case.
There are a lot of great websites, patient advocacy groups and others that give guidance here. There's, of course, HealthTree Foundation. There's Lymphoma Research Foundation. People hear CLL, the second L is leukemia, and then sometimes I say lymphoma. This leukemia and lymphoma are actually all spectrum of disease. The full name of CLL is CLL/SLL, chronic lymphocytic leukemia, small lymphocytic lymphoma. You can hear it's actually one disease with a leukemia lymphoma name. So folks at the Lymphoma Research Foundation still have a lot of expertise and recommendations for places to get good care from, and the Leukemia Lymphoma Society is another one that has great referral options for how to find great specialists. Really, it's just folks that do nothing but take care of patients with CLL and lymphoma. So, we're very lucky. Community oncologists are brilliant, and yet their job is a very hard one. They have to take care of lung cancer, breast cancer, kidney cancer, bladder cancer, melanoma. It goes on and on. So the proportion of that time that they can be taking care of leukemia, lymphoma patients, it can only be so much. They have all these patients to take care of. We're very lucky at academic centers and specialty centers especially. For example, NCI-designated cancer centers are ones where we've certainly divvied up the practice into specialty care. And you can also just Google NCI-designated cancer centers, and there's one in every state and probably one not too far away from any patient. And we're very lucky to only take care of folks with CLL and lymphomas, so it just gives more experience with all the nuances of those diseases.
So CLL is not that common a cancer as many of the other cancers like colon cancer or breast cancer. So having a center with a person who sees only CLL is not that common. You do have, Memorial Sloan Kettering is one of them, where we have CLL focused specialists, but that's not always the case. So in general, you would find doctors who specialize in blood cancers who can treat CLL, and that's the more common. But in general, a person who sees and is comfortable with seeing enough number of CLL new visits can be considered a specialist in CLL. That would, because many of the drugs that we use for CLL are not different from the drugs we use in other blood cancers. Some of them are. And that's where having a second opinion can be helpful. But in general, I think blood cancer doctors are the ones who treat CLL.